Knock, knock.
Hello.
Hello, I'm Cillora Hicks. I'm a USM resident, and I'll be working with the anesthesia department to make sure your care goes smoothly today.
Okay, good.
What's your name?
Kim.
Kim, and what's your last name?
Burks.
Can you tell me your date of birth?
2/27/80.
Okay, great. Well, again, I'm Cillora, and I'll be participating in your anesthesia care. I'm going to wash my hands. Today, I'm coming in just to ask you a couple of questions about your medical history,
Okay.
and I want you to make sure you ask me any questions as we're going along, okay? What procedure are you having done today?
A colonoscopy.
A colonoscopy. Did you take the bowel prep last night?
I did. It was awful.
Oh, I'm sorry to hear that. Okay, have you had anything to eat or drink since midnight?
No.
So you took the bowel prep, you didn't have anything to eat or drink. Do you have any allergies?
No.
No non-drug allergies. Great. Do you take any medications on a daily basis?
I take Zyrtec
Okay,
for my allergies.
just so you have seasonal allergies.
Mm-hmm.
Okay, any other medications?
No.
Okay. Do you smoke?
No.
You drink alcohol?
Occasionally.
Okay, how much do you drink?
Just a glass of wine every once in a while.
Okay,
Maybe
what
once or
about
twice
drugs? Any kind of drug use?
No.
Okay, have you ever had surgery before?
No.
Has anyone in your family had a reaction to anesthesia that you know of?
No, my mom gets nauseated, but that's about it.
But as far as increase in temperature or increase in heart rate after giving anesthesia, nothing
No.
like that? Okay, good. Well, again, now I'm going to go through your history, and I want you to make sure you just tell me if any of these things apply to you. Do you have any heart problems, hypertension, MI in the past, any chest pain,
No.
enlarged heart? Perfect. What about any breathing problems? Asthma, COPD, bronchitis, emphysema, sleep apnea?
Well, I was diagnosed with sleep apnea, but I don't wear the machine.
You don't use a machine?
Mm-hmm.
Do you sleep on more than one pillow?
No.
Okay. And you don't have any, what about as you're climbing stairs, do you get short of breath when you're climbing stairs?
No.
Okay, good. Acid reflux?
No.
Liver problems?
No.
Have you ever had a hernia before?
No.
Okay, good. Any kind of bleeding problems? Any kind of blood coagulation problems? Do you take aspirin, Plavix, Coumadin?
No.
Okay. No anemia, no blood transfusions in the past?
No.
Okay, what about a stroke?
No.
No history of a stroke, seizures,
No.
any kind of mental or psychiatric disorders?
Well, we ain't even gonna go there.
Okay, so you have not been diagnosed with
No.
okay, good. Diabetes,
No.
thyroid disease,
No.
kidney problems,
No.
and no kind of arthritis or joint pain.
No.
Okay, well, good. Well, again, you're coming in for a colonoscopy. You already had the bowel prep. So I want to explain the procedure to you before we head back to the room. So we're going to roll you back to the GI room. I'm going to put some monitors on you. I'm going to let you breathe some oxygen. The physician will come in and talk to you before you drift out to sleep. I'll get you to turn to your left side, and he'll come in and talk to you. I'll give you some medicine that's going to help you relax and you'll drift out to sleep. You may wake up during the procedure. That's normal. If you have any kind of pain or if it gets too uncomfortable, I can give you some medicine to put you back to sleep, okay? But if you wake up, that's fine. I'll be with you the whole
make
time.
Sure I don't wake up.
I will. You have any questions?
No.
Okay, well, I'll get you to sign this consent, Miss Burks, okay?
Okay.
Perfect. Now we will begin your physical assessment.
Okay.
I'm going to wash my hands. I'm putting gloves on. All right, Miss Burks. I'm going to start from your head and I'll just work my way down. Can you sit up on the side of the bed for me? All right, I'm going to feel your head. I'm feeling your lymph nodes. I'm feeling your head for tenderness, any nodules. No nodules, no in your lymph nodes. I'm going to use this pen light, and I want you to look straight at me. Pupils are equal, round, reactive to light. Can you follow my finger? Convergence is good. You said you didn't have any pain
No.
in here or anything? Any signs or symptoms of a cold? No enlarged lymph nodes or anything?
No.
Okay. Can you put my hands together? Now, put my hands apart. Spread them apart. Good. Squeeze my hands. Okay, your strength is good. I'm going to go ahead and check your pulses. Pulses are equal and bounding. All right, you can relax your hand. Now I'm going to take a listen to your heart. You have a good heartbeat. Now I just want you to take some deep breaths. I'm going to listen to your lung sounds. I'm going to go to the back. And listen back here as well. Deep breath. Okay. Can you take a deep breath for me? Symmetry is good. Okay, Miss Burks. Now I am going to ask you to lay down. I already checked your pulses in your hand. Now I'm going to move to your feet. Good. Pedal pulses. Can you pull up against my hand? All right, now push. Perfect. Good strength in your lower extremities. I'm going to take a listen to your abdomen.
It's probably growling.
I'm going to feel first to make sure I don't feel anything abnormal. Feels good. I'm going to take a listen. Vowel sounds are present and normal. Now I'm going to just percuss. Good. Now I'm going to ask you some, just look in your mouth and just ask you some questions about your mouth. Do you have anything movable in your mouth?
No.
Can you open your mouth and stick your tongue out? Okay, Malin Patty, 1. Good. The thyroid mental distance is greater than 3. Can you protrude your can you protrude your bottom lip? Try to bite your top lip with your bottom lip. Good. That's perfect. No overbite present. Okay, Miss Birch, you can sit up for me. Okay, again, I just wanted to make sure you didn't have any questions. And if you don't, then we'll conclude this assessment.
Just make sure I'm asleep the entire time.
I will.